Hi, this is Michelle Glaze, Director of Professional Outreach for Foundation Fighting Blindness,
Hi, this is Eric Bennardo, President of the Pittsburgh Chapter for the Foundation Fighting Blindness.
and you are listening to White Canes Connect.
Hey there, PA Federationists. Welcome to another episode of White Canes Connect, presented by the National Federation of the Blind of Pennsylvania. My name is David Goldstein. I am the treasurer of the Keystone Chapter. Joining me today, as always, is Keystone Chapter second vice president and co-host Lisa Bryant. Lisa, Happy New Year.
Happy New Year to you as well, David. And we are kicking it off with a great conversation that we had with Michelle Glaze, who is Director of Professional Outreach at Foundation Fighting Blindness, and Eric Bennardo, who is the President of the Pittsburgh Chapter of the Foundation Fighting Blindness.
They talk about a lot of things, but one thing that really sticks in my mind is the back and forth they have with various ophthalmologists, retina specialists, and things like that. And one thing that I've noticed, and I'm wondering if a lot of our listeners have noticed it too, once you're to the legally blind or blind section of your vision journey, doctors really don't seem to care too much. They're just trying to make you comfortable. They don't really have any answers for us. And it seems like the Foundation Fighting Blindness has a way to make doctors care more, whether it's all the money they give for research or what it is. And I'm not sure, but that's one of the big differences that I see with what we hear today from Michelle and from Eric.
It's very hopeful after Michelle said that, because all of us have heard, we have our own stories and we've heard the stories of others who, they're diagnosed and that's sort of it. Like I said in the conversation, it seems like the medical professionals don't really know what to do with this. So thank goodness for the work that the foundation is doing. So let's take a listen.
Michelle and Eric, thanks so much for being with us today.
Thank you for having us.
Nice to be here.
Hi, guys. Welcome to White Canes Connect. I was saying before we were coming on the show that you have so many resources and events, both on a national and local levels, that this is going to be a very good conversation. So looking forward to you sharing all of the things going on at the foundation. But before that, I want to give each of you a time to introduce yourself. Tell us about your connection to the foundation. You can share as much about vision conditions as you'd like. And Michelle, I think I'll start it with you.
Sure, thank you. So Michelle Glaze, I grew up in a very small town out in California. I was very much a tomboy growing up, and I was very involved in a lot of sports, including softball. Just before the age of 30, I was playing softball in a tournament. It was a bright, sunny California day. And after the tournament, I came home to my very small apartment. And when I walked in, I realized that my eyes weren't adjusting. It took a very long time, what felt like an eternity, for me to be able to see details in my front room. And so I decided to go to an optometrist. And when I went to my appointment, they did a visual field test, which I failed miserably. And that turned into a series of tests that day. I left that optometrist's office and was told that I needed to go see a retina specialist. A couple of years later, I did. And after a very long visit at an academic center that I had never been to before, whole series of tests, my eyes were dilated, numbing drops, flashes of light, electrodes, all the while my anxiety, just peaking, wondering what was going on. At the end of that visit, I was told that I have a disease called retinitis pigmentosa. And no one in my family had this eye condition. So it was very much a shock, very much a surprise.
Yeah.
And like many people, I really didn't know where to turn, what to think, what to expect. And there were a lot of questions that I had about my future.
Yeah.
So So that was kind of the beginning of my vision loss journey. And like many people who are diagnosed with these conditions, I went into a period of grieving. For me, it was deeply rooted in denial. So it took about 7 years before I began to wrap my head around this thing called retinitis pigmentosa. And a lot went on during those 7 years. But in 2011, I was first connected with the Foundation Fighting Blindness. I was drawn to the organization because the mission is to drive research to find treatments and cures for blinding retinal diseases. And I wanted to do something to help myself and others. So I participated in VisionWalk, which is the Foundation's flagship fundraiser that year. And well, the rest is history. So we'll start there.
Okay, that's a great start. It's funny, 2011 was a pivotal year for me and my vision journey as well, but this isn't about me. Eric, welcome to White Canes Connect. Tell us your story.
Yeah, it's great to be here. That was great, Michelle. Thank you. But yeah, so I'm 30 years old. I was actually diagnosed at age 2 with retinitis pigmentosa. So I don't have as a memory of the experience of the diagnosis and the initial reaction as Michelle does. I am also the only person in my family who has retinitis pigmentosa that we know of, going back at least several generations.
Wow.
And so it was a shock to the family, I imagine. I don't remember. I was only 2, but I feel like there was a lot of, well, what the heck? How did this happen? Or why is this happening? Sort of reaction. And I was not really aware myself of having a condition or knew that I was quote unquote different from the other kids until I was about 6 or 7 years old, maybe about 7. I had a friend over and we were just hanging out, doing whatever. And at the end of the day, when he had left to go home, my mom noticed that my left eye was turning inward. And it was the first time that I had ever even known that something like that, like nothing ever came up, in my life to indicate that something was going on. And we went to the ophthalmologist that I'd been going to since I was 2. And they said I had a full retinal detachment in the left eye. So, and it turned out that I actually had no vision in that eye anymore either, 0 vision. And I don't remember ever having vision in that eye, but I ended up having a retinal reattachment surgery when I was like 8 or 9. And, my vision has been actually pretty steady as long as I can remember. So I only have vision in my right eye. Okay. So I'm monocular, and I don't know what my degrees are. I don't know, and stuff like that. But I do know that I have central vision in my right eye that's corrected to 20/40 with glasses. And I have a little bit of peripheral vision as well remaining. But it's all of my vision is concentrated in that one spot of central vision and a little bit of periphery in my right eye. Yeah.
Right.
It's been like that for as long as I can remember. So I have a little bit of an atypical experience with how my vision has been because I've been so stable for so long, but also legally blind for so long. So it's not like I've had a steady sort of predictable progression like a lot of folks have in the RP community.
So when you went through the retina detachment surgery, you had got to lay some way for 22, 23 hours a day. How did that work out when you were a kid? Do you remember that time?
So I didn't have to do any of that. I only recently learned of people having to do stuff like that after the post-op. All I remember is not being able to really partake in any sort of physical activity or lift things or bend over for like a 6-week period. I didn't have any of the restrictions, like crazy restrictions, like laying for, over 20 hours a day and stuff. I still went to school, every day and, sat and I don't recall any other like major sort of like adjustments I had to make. I just remember a lot of pain and the fact that the whites of my eye were like completely blood red for about a week after the operation. Yeah. But
tell us how you came to know about Foundation Fighting Blindness.
Yeah. So very similarly to Michelle, I graduated from Penn State in 2015, and I had a very, very lengthy job search because I could never drive, and that's a barrier to employment, especially when you don't live like in the middle of like New York City or something.
Right.
And I had a very lengty job search, and finally, it was actually suggested by a relative of mine. Hey, why don't you see if the FFB, the Foundation Fighting Blindness, has any job opportunities for you? Now, I had known about the foundation maybe since I was like in my teenage years, but never had any official interaction with them. And I sent them an inquiry to, like about 6 years ago, sent them an inquiry about, hey, do you guys have any job opportunities for someone like me? I have a bachelor's degree in communications from Penn State. This was what my internship was. This is what I know how to do. Is there anything available? And they actually wrote back to me and said that they don't have any paid positions available. However, they suggested that I get involved with the VisionWalk, like Michelle. So, in 2017, in fall of 2017, I got involved with the VisionWalk in Pittsburgh and volunteered as a fundraiser for the VisionWalk for 17, 18, 19, and 20. And then about a year and a half ago, in early 2021, I was approached by the events director for the Mid-Atlantic with the opportunity to become the chapter president. He had me on a short list, and I said, of course. And the rest is history, as we both have cycled back to here.
So is that position a paid position, the chapter president?
No, it's not.
We have some remarkable volunteers at the Foundation Fighting Blindness. Thank you for your dedication, Eric.
So we wanted to talk about the history and the mission of the foundation.
Sure. So the Foundation Fighting Blindness has been around for over 50 years. The organization began by a small group of individuals who either were affected by an inherited retinal disease or they had a loved one who was impacted. And Mr. Gordon Gund was one of our founding members. He's still very involved in the Foundation Fighting Blindness and in the decision making and the direction of the organization. But over the last 50 plus years, the foundation has become the largest private funder of retinal degenerative disease research in the world. The foundation funds all sorts of different types of research projects. So lab, translational, clinical trials, natural history studies. The foundation funds a genetic testing program and a registry. And the overall mission of the organization is to drive research to find treatments and cures for blinding retinal diseases like retinitis pigmentosa, Stargardt disease, Usher syndrome, LCA, and even forms of age-related macular degeneration.
So that's the sort of big picture nationally. Eric, how are the chapters supporting that? Two questions. How do the chapters serve people locally? So you're in Pittsburgh. Tell us about how you're serving that community, and then how you integrate back nationally or feed back into the foundation on a national level.
Yeah, that's a very interesting question, because right around the time that I became involved as chapter president, about a year and a half ago, the foundation had just around that time started to reinvigorate the chapters nationwide. Okay. And they started to implement they took feedback from current chapter presidents and started to implement new ways for the chapters broadly, sort of a uniform way to benefit the community. And one of those things, and I'll answer the first part of your question about what the individual chapters do for their communities, is we started having twice a year these events called speaker series. And they were virtual for a lot of last year because of the continuation of the COVID-19 pandemic. However, this year we started to have more in-person events. And what these events is they're focused on a speaker who comes in and gives some sort of a talk about some sort of topic related to work that the foundation is doing, as it relates to research, as it relates to the science that is the discoveries that are being made due to the funding that the foundation is providing for the research, whatever the case may be. And some of the speaker series could also cover things that aren't as related to the science and maybe more along the lines of like orientation and mobility and living with vision loss, as opposed to just talking about some of the science at a high level. That's something that is like a national effort of the foundation, but is being implemented on an individual basis by each of the individual chapters in the individual markets. We just had our first speaker series in Pittsburgh back in August, and we actually had one of the most people at the forefront of retinal research in the world. It was Dr. Jose Allen Sahel, who's actually the chairman of the UPMC Department of Ophthalmology, which is the big hospital system here in Pittsburgh.
Okay.
So we happened to have him here, and he was gracious enough to lend us a couple hours of his time to inform the attendees about his research and what he's doing. So those are the big things that I can speak intelligently about that individual chapters are doing. Of course, each chapter also has different things that they do. Like we have the vision walks every year. That's something that's like also like a national effort, but is something that each individual chapter implements in their own market. And those, as Michelle has indicated earlier, the vision walks are like the flagship like fundraisers for the foundation. They happen every year. We have a batch of them that happen in the spring, a batch of them that happen in the fall, and it's been a very, very reliable source of fundraising for the foundation. That's really what a lot of the chapters are doing, like I said, uniformly. And of course, there's other chapters that host different events throughout the year, like dining in the dark, something called Dining in the Dark, where you go blindfolded and you eat. I'm sure you guys have heard of those events.
Yes.
And every chapter just does a really good job at sort of adding their own flavor to different events and different things that they do, different do-it-yourself fundraisers that different folks come up with in the chapters, and how that ties into the FFB nationally. I feel like I kind of already answered it, is it's all kind of just driving, like all the money's going to the same place.
Yeah.
So it's so I guess I could answer it in two ways. One, there's a collaborative effort between us as chapter presidents. Every month around the end of the month, we have a chapter president's call on Zoom, and we collaborate. We talk about notable things going on at the foundation. We pick each other's brains. We give each other feedback and suggestions. So that's a really cool thing that we do. And then the other thing is the fact that all of the money is going in the same place. It's not like we have like, oh, we're doing what we're doing here in Pittsburgh and winging it with the funds we get and Chicago and wherever. It's all going in the same place. So it is a very, very well-oiled machine. And it's been 50 years, they've had 50 years to fine tune all of that. And it's really an effective dynamic between all the chapters, the relationships we have with ourselves, and then the relationship that we have national.
Yeah. That's what it sounds like. Do you have a convention? Is there an annual convention?
So we have,
or state.
So we have an event every other year called the Visions Conference, and it's a large conference. Michelle has been to many more than I have, I imagine. My first one was this year.
Actually, my first one was this year as well.
Oh, wow.
Wow. Okay. All right. Well, yeah. So they have them every other year. Now, so they didn't have one in 2020 for obvious reasons, because of the pandemic.
Right.
So it had been 4 years since they've had one, and it's a very big event. I mean, Michelle, there were hundreds of people there, hundreds, from around the country, and there are different speakers that talk about like assistive technology, gene therapies, research, orientation and mobility, living with vision loss, the psychology of living with vision loss, all kinds of different ways of approaching, educating the public and each other about what the foundation does, as well as, some of those other seminars that I indicated that are helping us as those who are affected live the best lives we can while the foundation is carrying out its mission to try to find these treatments and cures.
And, Eric, I'm glad that you mentioned that, because circling back around to the chapter piece, just so your listeners are aware, the foundation has chapters in over 40 markets all over the United States. And they're typically in larger metropolitan areas. But, obviously we've iterated and reiterated that the foundation is a research focused organization, right? Mm-hmm. But in the end, through the work we do, we want to be able to provide our constituency, people that are impacted by these diseases, with what I see as three gifts: knowledge, community, and hope. And, the local chapters really provide that sense of community, providing information through speaker series about the research that's ongoing, the clinical trials, genetic testing, et cetera. But also through that community piece at a local level, individuals that are impacted by these diseases can learn about resources like orientation and mobility, low vision services, rehabilitation, local pieces that can help with independent living now. And then, through the research that's ongoing and, the work that the foundation's doing overall, it gives people such a high level of optimism and hope for the future in finding treatments and cures for these diseases that impact us in this community. So I think that's an important factor of the chapter network, just to highlight as well for your listeners.
The one thing to me that is so important about anybody that has any kind of vision issues is to be with other folks that are in the same boat, because they understand where you're coming from. So everybody with RP or Usher syndrome or whatever it may be that get together in a FFB chapter, they know that, hey, I went to my ophthalmologist and this is what he told me. And then that somebody else in the chapter may say, oh yeah, I went and did that and this happened and then that happened. So why don't you try this or try that? For the same reason that we're doing this podcast, is to make folks aware and to help somebody in Pittsburgh may be doing something different from somebody in Philadelphia, and somebody in Philadelphia may say, "Oh, I'm going to try that," and it's just something that's just a great thing that when folks have something similar, they're not on their own. You can't go to your family member and say, "Hey, this is what's going on. I never heard of that. I don't know what that is." Getting back to the VisionWalk, because you both seem to have been dragged in that way. How does it work when you're doing, when one is coming up? So Eric, you have a chapter, and if it's coming up, what happens? Do you go out and ask people to donate for a certain amount of miles you'll walk just to complete it? Is there any kind of competition between the chapters or between people within a chapter? Hey, I'm going to do this and this, or we're going to raise X number of dollars. If you raise more, we'll do something different. Anything like that?
I'll speak for Pittsburgh because everybody does things a little bit differently, just depending on chapter. And I will make a point about the Vision Walks. The Vision Walk also has like a committee of chair people, and that chairperson may not necessarily be the president of the chapter. Now, I am actually the co-chair of the Vision Walk and the chapter president, so I can speak sort of from both angles. So there aren't, at least in Pittsburgh, there aren't like pledging, you mentioned like pledging for number of like steps or miles or right. completed or anything like that. We don't do anything like that. But what we mainly focus on is we focus on individual contribute. So each individual has the option to create a team on the website for the Vision Walk. And the objective of that team is to find as many people as they can to join their team, and in turn, everybody get the word out and try to raise as many individual contributions from as many individual folks as possible. Another key objective of these Vision Walks is to acquire sponsors. And these sponsors can come in at various levels. It starts at X amount of dollars all the way up to, the sky's the limit. And you get different sort of sponsor designations and different perks depending on how much you donate as a sponsor. And a lot of our sponsors are like local eye doctors' offices and entities like that, small businesses in the community. And those are really the main sort of fundraising streams that build sort of the funds that are raised by a Vision Walk. And each walk, each city has an individual goal that is determined every year. And it's obviously the objective of us to do everything we can to get as close to that goal as possible and to exceed it if possible.
Can you share what the goal was for the last one that you guys did?
Yeah. So Pittsburgh's goal was 95,000.
Wow.
Yeah.
And how many people participated in that?
I think there were probably about 200 of us on walk
Oh,
day.
wow. Okay.
Yeah. It was pretty big. It was about the same last year too. I think Pittsburgh usually, because I've only gone to a few of them, so I don't know the whole it's like there's been like 15 of them. So I only have, the last maybe 5 years as a point of reference, but there's been about a couple hundred every year, which is pretty phenomenal when one thinks about it. Pittsburgh's not the biggest city. The metro is a decent size, but the actual city proper is not a very big city. So for 200 people to come together for this cause that's honestly relatively niche, this is a very niche cause. I mean, not a lot of people know somebody who has an inherited retinal disease. There's the majority of people in my life. I mean, I could probably count on one hand the amount of people who knew what that I've ever run into, who knew what RP was outside of knowing me. Everybody else knows what it is by virtue of knowing me. So it is a very, very niche sort of thing. And it's great that the foundation is able to raise so much, millions of dollars every year, from these walks that these people decide to show up for. So.
Well, and being that they're, the inherited retinal diseases are very rare, going back to that, the connection, the community, VisionWalk really serves as an opportunity for people to meet others, to engage in a worthy cause, but also get connected to others with these rare diseases that they can connect with and, learn from and share experiences with. And there's a camaraderie there that is very, very unique. And just being involved in a vision walk, for me, it was so empowering. My vision walk for me was the first time that I ever stepped out publicly and said, I'm a person with vision loss. I am a person with an inherited retinal disease. And oh my goodness, look at all these other people that are here that are either having the same experience or they love someone that they're supporting through this effort. So it is about fundraising, of course. I mean, we are a nonprofit, so we have to fundraise in order to fund very expensive clinical research, but it's also an opportunity to raise awareness and just really broaden your sense of community with others who get it.
So fundraising is, of course, a big part of what you do, but tell us about some of the other, and we've mentioned research. What other resources are you providing? And I guess how, because I was curious if someone wanted to participate in a trial in their community, could they get funding support from the foundation, or just what's the sense of some of the services that you're providing?
So the foundation offers knowledge. We have a lot of educational opportunities, starting with our website, which is fightingblindness.org. As an individual who's newly diagnosed or somebody who has had, an inherited retinal disease or age-related macular degeneration for a while, the website serves as a platform to learn about the different inherited retinal diseases, to hear inspirational stories from people who live it, to learn about the research, to hear about events, things like that. There's a ton of information on our website. But another really big resource that the Foundation Fighting Blindness offers is no-cost genetic testing, no-cost genetic counseling, and a patient registry. And in your question about how do I get connected with a clinical trial, genetic testing is really important for that. And quite frankly, genetic testing is important for a number of other reasons. It can help confirm a clinical diagnosis. It can help an individual understand inheritance patterns and risk factors for other family members. So it really does help in understanding and managing your inherited retinal disease. The foundation is currently partnering with two partners to offer no-cost genetic testing and no-cost genetic counseling. No-cost genetic testing is offered through Blueprint Genetics. It's called the My Retina Tracker Panel, which is a 351 gene panel. And then we partner with a company called Informs DNA to offer no-cost genetic counseling. And the foundation does require genetic counseling as part of this program. The two truly go hand in hand, because just getting a genetic diagnosis is not enough. It doesn't help you to understand that disease. So a really great offering. And for people that have got genetic testing outside of this program, it can be very expensive, near $1,000 or more in some cases. So to be able to get a no-cost genetic test and no-cost genetic counseling is a really wonderful offering from the foundation.
Yeah.
The other piece to that, and what bridges patients with an inherited retinal disease to the clinical research pipeline, if you will, is our My Retina Tracker registry. And the registry is a global platform, so it's open to individuals within the United States and outside. It's open to anybody who has been diagnosed with an inherited retinal disease. And the registry is a way to really raise your hand and be seen by the research community as an individual with an inherited retinal disease. So myretinatracker.org is the website, and anybody with an inherited retinal disease can go to that site and create a record. There is some basic information that's asked: demographics, name, address, date of birth. And then they also ask some questions around your clinical diagnosis, progression of disease. There are some surveys and things. Genetic testing information, if you've received that, is really important to include, but it's not required. And what the registry does is it serves as a way for researchers and biotech companies who are either looking to begin a clinical trial or recruit for a clinical trial to identify patients that might qualify. Now, the registry is completely confidential, so the foundation does not share or disseminate patient data unless it's de-identified with any third party. So we take patient privacy very, very seriously. But it is a way that a company can reach out to our very small team at the foundation, and a query can be done to identify potential candidates within the registry. What the foundation then does is reaches out to those individuals and lets them know that they potentially can qualify for a trial. They give the information about that trial to the patient or individual, and it's in the individual's control to contact or learn more about that trial if there's an interest. So kind of two separate offerings there: the no-cost genetic testing and genetic counseling program, and the registry. The two go hand in hand, but they also exist separately. So a really big resource, I think, for people that are wanting to learn more about their disease and get a clear diagnosis of their retinal disease.
And that's the starting point for somebody to come in, would be to go to the website, do all that, and then things happen at that point.
Yeah, I mean, I think that the website is a great place to start. The chapters are also a great place to start. So if if as an individual with either an inherited retinal disease or age-related macular degeneration, if you go to our site, you can search for a local chapter. If there is a local chapter in your area, I would really recommend connecting that way first. Certainly, there's a ton of information on the site, but you can find information about the chapters, events, inherited retinal disease, clinical trials, genetic testing. There's a ton on our site to explore. But that chapter really gives you that local community that can't be obtained just through the website, obviously.
And that is very easy to find on the website. It's right up at the top. I mean, you can't really get past that to look at other things before crossing over, find a local chapter. I did notice that.
Yeah.
Are there we call them at large. Are there resources, or are there places that people can connect if they're not in a major metropolitan area?
In the virtual world we live in now, pretty much anything is accessible virtually. And the foundation does a really good job of providing national webinars and things for people to engage in, even if they're not connected to a local chapter. In fact, the chapter network does a national webinar, usually twice a year. That's very well done. It's usually a 2-hour webinar, and there are panelists, research highlights, breakthroughs, all sorts of information. And that's accessible virtually. So if you don't have a local chapter in your area, you could contact the chapter that is closest to you and find some ways to connect virtually. They do host, virtual, and Eric could probably speak to this even better than I could, but, virtual social hours and different types of events that are accessible, even if you can't show up in person. And Eric, I don't know if you want to share some of those highlights from your local market.
Yeah, so right now we don't do anything just like that. However, it is part of my plan, moving into the future to do things like that. And really, there's a clear interest from people that I've spoken to at the last couple of events that we've had here in Pittsburgh, that there is there's a desire for in-person support groups or socials, like once a quarter or every so often or whatever. However, to Michelle's point, with the need, and to everybody's point here, the need for and desire for people who don't reside in a metropolitan area to want to be part of what we're doing and to be a part of our, family, so to speak. Yeah, virtual, whether it's a support group or just a social or a hangout, once every other month or once a quarter or however often people want, is definitely something that's on my to-do list as president. Yeah, definitely. So we're not doing it right yet, but there may be other chapters that are doing it. Maybe some of the bigger ones, maybe out west or something. But as far as I know, we haven't done that, and we are planning to do it.
And the foundation does a whole gamut of different virtual types of events. I mean, aside from the national chapter webinars, we have quarterly insight forum calls that highlight all that's ongoing with the Foundation Fighting Blindness. We have Music to Our Eyes series that highlights different, musical talent. So there are a lot of different opportunities. I would say once or twice a quarter, there's typically something going on virtually that can be tapped into by anyone from anywhere, really. So,
yeah. I wonder if you could speak to any success stories that have come out of research over the years. Any, advancements?
Yeah, I would say the biggest is the FDA-approved gene therapy called Luxturna. Yeah, so in, late 2017, Luxturna was approved. The Foundation Fighting Blindness was involved in a lot of the preclinical work that led up to that clinical trial breakthrough and FDA-approved therapy. In fact, the foundation donated about $10 million towards the research that led to that FDA approval. Luxturna is the first gene therapy that's been FDA approved for the eye or an inherited condition. And actually, it began at Children's Hospital of Philadelphia. So, and it has been just a remarkable breakthrough. It has, in the folks that have received Luxturna therapy, they've reported things like, being able to see the faces of their loved ones, stars in the sky. Children have been able to stop use of their white canes. So it has been a really tremendous breakthrough. And really, it is what has paved the way for a number of biotech and pharmaceutical companies to come into the retinal degenerative disease space. There are now over 40 clinical trials underway for the inherited retinal diseases and forms of dry age-related macular degeneration. And really, Luxturna was a stepping stone for that. So that's the biggest success so far. There are a few trials right now that are getting really close to FDA approval, either in or approaching that phase 3, which is the pivotal phase of the FDA approval process. And so hopefully we'll have another breakthrough soon. Fingers crossed.
It's not as specific as Michelle, with Luxturna, which is absolutely just a
it's
groundbreaking,
huge.
game-changing thing. I would just say that the transition also, and I don't know how long the Foundation Fighting Blindness has been working on gene agnostic therapies, because Luxturna is not a gene agnostic therapy, which means that it only works for people who have the specific type of gene defect.
Right.
Michelle mentioned earlier, there's 351 genes that we know of that could cause RP. Now, Luxturna works for one gene, as far as I know. And they've transitioned. There's been more talk, I'll say, because I'm not sure when the transition actually happened, but there's been more talk during a lot of these webinars that Michelle had mentioned, which I love. I love the quarterly insights forums and the webinars the FFB does, because if I wasn't involved in the FFB as much as I was and as intimately as I am, that would be like a game changer for me as far as the hope aspect of things and being assured that things are being worked on, and just being constantly reminded of what the FFB is doing. Now, I will tell you that the gene agnostic approaches that are being studied and researched are another success, what I'm going to call a success story, because it's changed the game to the point where we don't have to look at Luxturna as being like, okay, we solved one of 350 problems. We have 349 to go. Now with these gene agnostic approaches, it's like these therapies that could solve, 100 genes or 200 genes. It's a different type of approach as opposed to a gene therapy, that just targets one gene. So I think that's a very important piece of this success too, because it gives people, again, that hope that something is coming, and maybe, sooner than we all think. Who knows? We don't know.
Eric, that's a great ad. I'm glad that you mentioned that, and I'd be remiss if I didn't mention for Luxturna, it is for mutations in the gene RPE65, which typically causes Leber congenital amaurosis, but can also cause retinitis pigmentosa. So I'm glad that you brought that forward, and I think it's important to mention that specific genetic mutation. The gene agnostic therapies are remarkable because they do open up to such a broader audience. But, in addition to that, there are just a whole series of different therapeutic modalities that are being investigated. You've got the gene agnostic therapies. You've got gene therapy specifically. You've got gene editing strategies. CRISPR-Cas9 therapy is something that has been all over the news. You've got some oral medications that are being investigated. You've got neuroprotective strategies. You've got optogenetics, which is just a whole nother gamut of opportunities for people potentially with more advanced disease. So there are just a ton of different things that are being investigated, and a ton to be hopeful for. Yeah. Good ad, Eric.
Very, very good ad. As a matter of fact, you educated me on something, Eric, because I have only heard of gene-specific therapies. I didn't even know there was something in the works, where that's trying to treat more than just one specific gene. But I kind of wanted to also just maybe educate some people on the process of moving things forward to the glorified status of FDA approval. And those are those three phases you mentioned. I know safety, of course, is one. Can you just briefly talk about the phases?
Yeah, I will certainly do my best to. So the first stage is phase 1, and that's typically a very small subset of individuals impacted by disease, and it is specifically to prove safety. Once safety has been proven, then it moves to phase 2. And phase 2, they're still looking at safety. They expand out the number of participants, but they begin to look at efficacy and different efficacy parameters. If a trial moves beyond that to phase 3, then they're really beginning to open things up. So you may have multiple centers, more individuals who are participating, and they're looking even more at the efficacy piece for whatever therapy they're investigating. from there, then it would move to an FDA approval as long as everything is going well. And there are a lot of different factors that go into an FDA approval. I mean, there are endpoints that are looked at. There are different criteria that a patient would have to qualify for to even begin and participate in the trial. There's a lot that can go wrong in a trial. So, each of those phases is really important to make sure that a therapy is safe and it does work. And the trial design and the delivery system of the therapy can all have a role in how far a trial continues to move forward as well. So lots of moving pieces as far as the clinical trial process is going.
Could someone go on your site? Because I know my gene has been identified. Could someone go on the site and do a search and see what the status is in terms of the research you're working on for a particular gene?
Yes.
So there are a couple of different ways that can be done. On the Foundation site, there is a section that you can click on, and I believe that it's titled Research at this point. And there is a clinical trial pipeline. And that pipeline does highlight the different trials that are underway for the inherited retinal diseases and dry age-related macular degeneration. However, there's another site, it's clinicaltrials.gov, and anyone can go to that site as well. You have a lot more parameters and information that you can enter to specifically search for different projects that are underway. I will just caution listeners, if you go to clinicaltrials.gov and you come across a stem cell therapy and it is not FDA approved, you want to be very cautious of that. In any clinical trial, as a patient, if you're being approached and asked to pay for something, you should steer clear of that. All of these companies that are developing different therapies, and again, we've talked about gene therapy, there are cell-based therapies, which are stem cell therapies, neuroprotective strategies, oral medications, optogenetics. These companies that are developing these trials, in most cases, are going to offer to provide financial support for a patient that wants to be involved. So they're not going to be asking somebody to pay to participate. That's a big red flag. So just, a little caution when it comes to that clinicaltrials.gov site. Be careful at the trials that you're looking at.
Yeah. Eric, I heard you chime in with a yes. Did you want to add anything on to that?
No, I was just going to talk about that pipeline that Michelle mentioned. Yeah, and how cool it is, and it's a really great resource, and I enjoy taking a look at it occasionally just to see where things are, because there are 40 clinical trials right now, and I think there may be about 3 or 4, if not more, give or take, for my specific gene. So it's fun to take a look at. See,
lucky you.
Yeah. Well, I will tell you that the caveat is that I am monocular, so I'm not a candidate for any clinical trials. So it's just a matter of seeing. It's just a matter of seeing where things are as it relates to getting that final FDA approval.
Now, why aren't you a candidate?
I think it's a safety and ethics thing because I only have one to lose. And I don't want to quote anybody on that. But that's more or less what I've been told, that because I'm monocular, I don't fit the parameters for at least the vast majority of clinical trials. Nor would I want to take the chance.
I wonder if you could each speak then to where the need is. I'm sure fundraising is top of the list, but Eric, what do you see as your most pressing need to advance the mission on a local level? Do you just need people to come out to meetings? Do you need more volunteers to hand out information? I'm just thinking of, just a couple of examples. What would you say you need?
On a local level, just getting people to come out and to to be a part of the chapter, because our chapter, the Pittsburgh chapter in particular, is one of those recently reinvigorated chapters. I think it had kind of like a little bit of a lull for a little bit of time, and I am fortunate enough to be a part of that sort of revitalization. So it is kind of just getting the word out there that we are here.
Right,
we are intending to be that sort of beacon of resources and hope in the community. And it's a matter of us getting ourselves established in order to attract people to come to perpetuate the mission, both from an outreach and information and education standpoint, as well as telling people what kind of resources that are available, and of course, fundraising. So,
and are there dues for the chapter?
No,
it's just, you just, hey, this sounds like something I want to be part of. You just show up, and whenever there's a meeting.
Yeah.
And how about structure for, you're the president, is there a board?
That,
Is there a treasurer?
Are there other officers?
Other officers on a board?
So that is a great question. And I was going to mention this hopefully at some point during the interview. So let's tackle it now. So each chapter has 6 volunteer leadership positions. So we have there's a president, a vice president, a revenue chair, an education chair, a diversity and inclusion chair, and a resource chair. Now, Pittsburgh needs a VP, vice president, a revenue chair, and a diversity and inclusion chair. So I mentioned kind of like that we're kind of at the grassroots as we're trying to revitalize ourselves. That's part of it, is sort of continuing to build out that leadership team, which I think would be a really solid step towards getting more people involved in an intimate way, a leadership way, to try to get people, pull their networks and try to get people through the door through outreach and get things going. Yeah.
So you were able to get 200 or so people to come out for the VisionWalk, and even at the level that you guys are at. So looking down the road a year or 2 or 3, I would imagine as you build that, your organization, your chapter, that's just going to help the things like the VisionWalk grow exponentially, I would imagine.
Yeah, absolutely. And I don't know, as I mentioned before, I don't know I haven't studied the trends of all the VisionWalks. Like I said, there's been like 15 or 17 of them. And I know that there's been a couple hundred in the couple of events that I've attended. And I think you're right, though, that so far it's been like the 200 or so people that showed up is due to the longevity of the event. People who live in Pittsburgh, typically, a lot of people don't leave Pittsburgh. So things kind of stay the same for people, and which is something that's kind of unique to Pittsburgh in a way. And they just know about it from being around, but to your point about increasing the footprint of the chapter, I do imagine that in the next couple of years, we will be seeing more than 200 people. So that's the goal for sure.
Michelle, do you want to talk about national level needs?
Yeah, I mean, I think that education and awareness are 2 huge key points. And that's in a variety of different ways. I'm thinking about the professional piece, because in my role as Director of Professional Outreach, my job is to educate eye care professionals about the inherited retinal diseases and about resources available to patients with either an IRD or dry age-related macular degeneration. So I work nationally to connect with eye care professionals. And these are physicians, optometrists, ophthalmologists, retina specialists, low vision doctors, but also rehabilitation professionals, schools and colleges, universities, organizations. So a variety of different entities. And unfortunately, when people are diagnosed with specifically an inherited retinal disease, they're often still told, there's nothing that you can do. You're going to go blind, learn Braille, come see me in 2 years. There's so much education that is available and necessary so that when patients are receiving that initial diagnosis, they're told otherwise. They're told there is an organization that's driving research. There are local resources that can help you with your activities of daily living. There are others who are impacted with these diseases that you can connect with. There are devices and technologies that can aid you. There are adaptations for your home and work environment, and it goes on and on and on. The continuum of care, the medical piece, the low vision piece, the rehabilitation piece, they all need to come together so that individuals are provided with a path forward when they're diagnosed with these diseases. And so I'm very passionate about what we do in professional outreach because we're really pulling all those pieces together so that we can really narrow the gap between that clinical diagnosis and patients being connected to resources like the Foundation Fighting Blindness in the local chapter. And in fact, within the local chapter, the resource and education chair roles, I work very closely with those volunteers because within their local community, they can really help to educate the professionals that we've outlined to help ensure that patients are receiving the care and guidance and support that they need early on.
I'm very glad you brought that up. When I, was first diagnosed as legally blind, I wasn't offered anything by my doctor. And that, I'm still hearing those stories, but maybe they're stories from people who are, a little older. It sounds like, are you seeing an improvement? Are you seeing more professionals, medical professionals being receptive and even seeking out resources to give their patients? Because there was a time where they just didn't seem to know what to do with us.
Yeah, absolutely. Again, it's all about awareness, right? Yeah. So when we're out talking with the eye care community, there are a few things that we recommend. Number one, patients be connected with the foundation. Because we can provide them with information about the research, genetic testing, local community, awareness around their disease. We also highly recommend that individuals receive genetic testing and genetic counseling. We recommend that they get connected to a low vision specialist and the rehabilitation sector. Oftentimes, an individual might not need those services right when they're diagnosed, but as the vision loss progresses, those services will become more and more meaningful. And in fact, I'm in what I call this transition period and realizing how vitally important those pieces are. And then, of course, the registry, the My Retina Tracker registry is something that we recommend and highlight to the eye care community because in order to continue to drive research, patients are needed for clinical trials. And it can be hard for the research community to find those patients without things like a registry. So the registry does help, again, bridge that gap between patients and finding treatments and cures. We do have as well a section of our website that highlights physicians who are interested in seeing patients with inherited retinal diseases and are specialized in the inherited retinal diseases. And that list is growing, right? So those key opinion leaders and those folks that are well-versed in the space also continue to educate their colleagues as well. So it's all about sharing, learning, educating, awareness, and that comes from us as patients and also from professional organizations in our space.
How about contact information, social media, anything you guys want to share?
The website and specifically to the local chapter piece, the chapter would be the best place to initially engage. And if you don't have a local chapter in your market, if you connect with whoever that chapter engagement manager is or president for the chapter closest to you, they can get you connected with somebody that can help. The foundation also has an email address. It's info@fightingblindness.org. That's a really good way to reach out and to ask to be contacted or to learn more about the foundation. So I would say that those would be the main channels for getting connected.
I also, and thank you guys for also asking about social media. I have a YouTube channel where I discuss a lot of things, but a big pillar of my channel is discussing my own experience with vision loss. So that may be something that hopefully is something that your viewers, your listeners would be interested in following.
And the foundation can be found on Facebook, Instagram, Twitter, LinkedIn, YouTube. So there are a variety of social media channels as well to stay connected with the foundation.
And Eric, you're looking for a slate of volunteers. If anyone is in the Pittsburgh area and wants to take a position, how would they contact you for that?
My email address is bennardoeric@yahoo.com. That's BENNARDOERIC@yahoo.com.
Eric and Michelle, this has been a very informative conversation, and thank you so much for joining us. I am actually looking very forward to following you guys. Thank you both again.
Oh, thank you for having us.
Thank you very much.
Thanks again to Michelle and Eric for giving us the information they have on Foundation Fighting Blindness. And Lisa, it was a lot of great stuff they had to say. And again, a lot of great fundraising ideas that we could probably use here within our organization.
Yes. And I actually am very encouraged by the work that they're doing. I encourage anyone out there to try to get involved with them. If there's anybody out there in Pittsburgh, Eric needs a slate of volunteers / officers. So reach out to them and just check out the website. They are doing tremendous work. They're making incredible advancements, as we heard, in terms of research. So I really like the work that they're doing. I'm very glad to have spoken with them.
Yeah, it was awesome to have them on. And as I mentioned in the interview, their website is great, and there'll be links in the show notes. The website right at the very top is find a chapter near you, and you just plug in your zip code, I think it was, and boom, you find out. If you're in the Philadelphia area, as Eric said, there's a chapter here and a chapter out in Pittsburgh. So if you're out in Pittsburgh, give Eric a buzz, an email, and get involved out there. Again, doing a lot of great things, raising a lot of money, which I was very, very surprised at the amount of money. And makes me think back to the $2,000 or so that we raised for Believe You Can, as, oh, that doesn't sound like so much now when he said 95,000. So,
but they are a very complimentary resource to the National Federation of the Blind. So have them on your bookmark their page, reach out to them, and just follow them. I actually do get emails from them. They are very, very active. So check them out.
Right, especially if you're in that boat of RP or Usher syndrome or Stargardt's or even age-related macular degeneration, give them a look. One of the big differences, it seems like, between the Foundation Fighting Blindness and the National Federation of the Blind is the advocacy that we do here in the NFB. And on that note, coming up at the end of January, in a few weeks, is Washington Seminar, which is a great time down in Washington where you get to lobby Congress and tell them what's important to us. There will be links in the show notes for what the agenda is for this year. And if you are able to, especially if you're in the Philadelphia area, it's very cheap to get down there. It's only about $20, less than $20 as I'm speaking to you, for the train each way. And you can go and you can learn and you can advocate for blind folks everywhere. And if you're interested in getting involved, Emily Gindelsberger is the one you want to talk to, and she is VP2 and NFBP.org. I will have a link to her email address in the show notes as well.
The Washington Seminar is always very important.
Yes, absolutely. And we would like to hear you as well. So please reach out. Give us a call at 267-338-4495. You've got up to 3 minutes. Leave your name and town. If you do leave a question, a comment, a tip, a show idea, a review. You like us? You hate us? What could we do better? What do we do not enough of? Whatever you've got. Again, 267-338-4495.
And if you are old school and just need to blurt out stream of conscious, you can always email us at whitecanesconnect@gmail.com.
Lisa, it was a great episode to start 2023.
Yes. Thank you. Thanks for listening.
Thanks for listening, everyone. Take care and Happy New Year.